enough to take an active and a real role that does influence decision-making and policy level. I guess I'll be hearing from the panel a lot of stories. I'm sure that they will tell us more about how young people are change makers, how are policies against them or with them, what are the opportunities they're creating or they're probably finding available in the conducive environment, if any, and how they are promoting a responsible role and active role in developing.
I'm a pediatric diabetologist. I came to Jordan in 2010 after having spent lifetime in Western societies, and I was shocked to see the disparity between healthcare in Jordan and the West. I lived in the UK for nearly 20 years. I started my private clinic as a pediatric diabetologist, and I was instantly faced with a lot of challenges. And started talking to myself, how can I help, how can I change things? Because what's the purpose of being here if we can change and improve things? So I started an organization called Fida'a, which in Arabic means the will to change. And our main objectives were the following. First, we wanted to raise awareness among families with children with diabetes and children with diabetes themselves. And number two, raise awareness in the society as how to perceive and treat and any data. We had no idea about the number of children with diabetes in Jordan. That was in 2010, not long ago. And our first mission was to start our own data collection as a small NGO. So we decided to partnership with the Ministry of Education, and we sent out a survey to all schools. And by the end of a year of data collection, we were able to give the first number of children with diabetes in Jordan, around 6,000 children with diabetes in Jordan. Okay, so it was a huge number and a huge impact that nobody knew about. So from that onwards, we decided to try and provide best care to those families. And then we were faced with another issue, which was cost. And sitting in my comfortable, lovely clinic, I was telling patients to go and do their blood checks and check their sugar and take their insulins and live a healthy life and a good lifestyle, and it was all useless. Because the first thing they told me is that they cannot afford sugar checks. I would like to tell you that the average income of a Jordanian in Jordan is 350 JDs. The cost of diabetes care for a child in a family is 100 JDs. So that's 1/3 of their income. And to go around telling people that we need policies and we need data and then do nothing about it is useless. So we were, as I would say, walking in a river, starting knee deep and then ending up 10-meter deep. We were starting with objectives of awareness. We were ending up with responsibilities of providing full medical health care. So we decided as an NGO to establish our own diabetes voluntary clinic. So we set up to establish the first voluntary diabetes clinic in Jordan. And all our workers are voluntary workers, healthcare professionals, and our administrative staff and our volunteers. We cater for 200 families with their children, and we provide full healthcare from. And one of the incidents we faced was a girl in school fainting and losing consciousness, and nobody knew that she had diabetes. The family had not told the school administration, and the only help they could provide her was to give her a glass of water and Panadol, whereas the solution would have been very simple. A glass of juice would have saved her life. So this is one of the issues. The other issue is the way that society looks at adolescents with chronic disease. It's not a nice look. People with diabetes have a disability. Take it or leave it, it is a disability. It does affect their life. It takes a lot of challenges. And if disability is not taken into perspective in school health, nothing will improve. One of the issues we have is school turning away children with diabetes, refusing to register them. You all talk about policies. The policy is there, but nobody implements it. It's in the Jordanian law that children with diabetes have the right for education and should not be turned away from school. Until this day, they are still turned away from school, refuse to be registered, and nobody's doing anything about it. Okay? So policies come and go, but implementation is the key issue. The other thing, the challenges they face are psychological issues. A lot of adolescents with diabetes have eating disorders. A lot of girls with diabetes have bulimia or anorexia nervosa. We do. Okay, so what I want to concentrate on, so that I do not move away from the main topic, is the role of the young people, how they can change things, and solutions. Okay? The role of young people. Young people are very good with social media, so we should use social media to our advantage in raising funds, in raising awareness. There is no better empowerment than a patient with diabetes to give support to another patient with diabetes. So, support groups among patients and their families is very, very good and is very important. And we have seen this in our organization, and we have support groups. Fida'a is one of the leading support groups for teenagers. And
thank you.
We deal with a lot of issues just on WhatsApp. We deal with a lot of issues just with meeting them. Very simple, inexpensive measures. The other thing is exercise and activities. Okay, we should really encourage. In Jordan, we do not have a lot of parks, a lot of places where young people can go and participate in exercise and activities. This is one of the team, and we will lose our enthusiasm. Okay. We cannot work without the support of the government agencies. We provide, let's say, very important care to those families. We have 200 families in our organization that take full advantage of our services. We save money for the government by looking after their children and their families. Half of the patients on dialysis are diabetics. Okay, so if we can save one patient from dialysis, this is a cost-cutting measure that is not to be taken lightly. Also, loss of work time, loss of school time, fertility clinics. These are cost-eating problems in Jordan, and we can help with that, but we do need the support of the government. Irada had many positive and negative experiences. One of our positive experiences was our schooling experiences. We went out, reached out to a lot of schools, we gave a lot of lectures to the teachers, to the students, to the parents. One of our negative experiences was trying to change school health. We could not change school health. We wanted to introduce diabetes education in schools, we wanted to introduce healthy lunches into schools, and we wanted to introduce something that's unique that's been applied in the United States, which is called school contracts. And school contracts are a contract between the family of a child with a disability, not necessarily diabetes, and the school. And it saves a lot of face for the school and the family. And it just entitles the rights of the child in the schools, what the parents expect from the school and what the school expects in return from the parents. A simple example is, a child with diabetes expects from school that if he has a hypoglycemic attack or low blood sugar attack, that the school can be able to intervene in a simple way. The school contract saves a lot of effort and saves face for school and the family. I just want to send out a message to all the people here. Policies are very important, yes, but they have no meaning if they're not implemented and not applied. We can spend all the money in the world on nice conferences, getting people from all around the world, spending money where they should be spent really, but at the end of the day, if there is no implementation, it's useless, it's of no benefit to anyone. So we do need policies, and policies need to be taken into consideration, but without implementation, they mean nothing. And there should be a partnership between the NGOs and the government, especially in relation to